Ever wonder what's really going on when a doctor shines that bright light in your eyes?
Well, it's way more than a vision check. They're actually getting a direct look at your brain.
It's the only place we can see your central nervous system without making a single cut.
A healthy pupil is easy to remember with Perla. Pupils equal, round, and reactive to light.
This happens because the signal from one eye is actually sent to both sides of the brain. This four-neuron circuit explains it all. It's why both pupils react, even if light only hits one. Okay, but what happens when this circuit is broken? Doctors can actually decode these clues.
Fun fact, about 20% of us have slightly different sized pupils. It's completely normal.
But a finding called a Marcus gun pupil? That's a red flag for optic nerve damage.
The brain basically misinterprets the weak signal as darkness, causing both pupils to paradoxically dilate.
Now, another classic condition is Horner's syndrome. It's known for a very distinct trio of symptoms.
See these three signs together? That tells doctors there's a lesion in the sympathetic nerve pathway.
Then there's this weird clue, light near dissociation. The pupil reacts to near objects, but not to light.
And this specific clue is a classic sign of neurosyphilis, pointing to a lesion in the midbrain.
The exam also helps map out the bigger picture. Different lesions create predictable patterns of vision loss.
For example, there's a pattern with a pretty memorable name, pie in the sky.
This pattern is caused by a lesion in the temporal lobe. It's an amazing diagnostic clue. Now let's look at optic neuritis. This is where the optic nerve itself is inflamed.
Symptoms like these are an urgent warning sign and are very commonly associated with multiple sclerosis.
Then you've got papilledema. This isn't about inflammation. It's a dangerous pressure buildup inside the skull.
And the critical thing is, vision can be normal at first. This makes the eye exam so vital.
So, let's compare them. This shows exactly how doctors can tell inflammation from high pressure.
So let's bring it all together. The pupil's clues are an incredibly powerful diagnostic summary.
This table really nails it. It shows the diagnostic power you get just by looking at the pupils.
So, if the eye is a window to the brain, what else could we discover by just looking closer?